Good day to all. I'm Dr. Gavino-Collins, and I'll be giving a short but hopefully informative lecture on variables. A lot of this will most likely be familiar to most of you and will just be a review of concepts that you already know. So a variable is the concept or idea that you're studying or looking for in your research. It's essentially a measurement or characteristic of an individual or setting, with variations that are inherent within it as well as variations between other individuals or setting. So it can be quantitative or qualitative, and this will define how you will measure your variable. So in research, we have your independent and dependent variables. So independent variables are also known as your predictor variables. These are the variables that are inherent in the study subjects or the study context and are not necessarily measured in the study, but affect the dependent variables or your outcome variables. And these outcome variables are the variables that you measure in your study. So quantitative variables are numerical, and they can be measured or ordered either as discrete or continuous values, while your qualitative variables are more commonly categorized in order to be measured. Nominal variables are classified into groups or classes, but they cannot be ranked because one value is not better than the other within the group. So examples given here, you have gender, professions, species. Now, ordinal variables are also grouped, but they can be ranked, meaning there are several classifications to one variable, and each classification could be better or worse than the other. So an example given here are your socioeconomic status, which could either be low, middle, or high. And then you have your nutritional status, which could either be well-nourished or malnourished. Interval variables are quantitative and equidistant, but the 0 point is arbitrary. So this is according to the proponent's preference. So the 0 point could be according to what the research proponent chooses it to be. Ratio variables are similar to your interval variables in that they are quantitative and equidistant, but the 0 point is fixed. So the research proponent cannot manipulate at which point in the value is your 0. So examples given here are your age, height, weight, blood pressure, for example, number of prenatal visits. In a study, variables have to be defined as they are used in that study in order to clarify how they are measured. So a conceptual definition uses other concepts to define your variable. For example, a study on maternal health services may be conceptually defined as services given at the health center focused on pregnant females. Operational definition, on the other hand, defines the variable as to how it is used in the study and in such a way as to make it measurable. So, for example, maternal health services may be operationally defined as the number of tetanus toxoid vaccinations given, or the absence or presence of prenatal consults in the health center. So in research, our concern is more towards the operational definition of variables, because then we have an idea if that variable's measurability is appropriate for achieving the objectives of your study. So when gathering information on variables used in a study, accuracy and precision are two essential qualities that must be observed in the measurement of these variables. So when talking about accuracy, this refers to how close the measurement is to the true value of the variable. And precision is the ability to get the true value every time the measurement is done. So two things contribute to accuracy and precision. So first is the device used to measure the variable, which should be the most appropriate device used to do that. Next, the device must be properly calibrated and matched against a gold standard to ensure its accuracy and precision. So, intra-device or instrument variations are affected by maintenance. A well-maintained device or instrument will most likely perform at top form more consistently. So, inter-device or instrument variations are affected by the craftsmanship of the device or instrument. So, obviously, good quality devices are more reliable. The age of the device will also affect its reliability and accuracy. So, a newer device will most likely function better than an old or worn out device. So, for example, when in the clinic, the best device to use to measure weight is a detecto scale or a variation of it because of its accuracy and precision in measuring weight. A bathroom scale has deviations from the true measurement and is therefore not the preferred device or instrument when clinically measuring weight. So, intra-reader variations are based on the reader's state of mind and body while doing the measurement. A reader who is tired or stressed at the time of the measurement will most likely make a mistake compared to someone who is rested and focused. So, inter-reader variations are affected by the skill level of the persons doing the measurement. Someone who has had proper training on how to correctly measure a device, or rather, measure a certain variable, or how to correctly use the measuring device, will most likely be more accurate and precise in measuring the variable than someone who isn't familiar or trained to do it. And there you have it. This ends my very short lecture on variables. Thank you very much for your kind attention.